What's up? Dr. Coggin here, and I want to give you 3 tips to improve your blood work today. Okay, so I'm going to go over 3 common scenarios that people will have issues with their blood work, and I want to give you a couple tips that you can implement right away, very straightforward. Okay, so first thing, if you have high cholesterol, okay, so if you consistently have high cholesterol, your doctor might say, oh, avoid these certain foods. I'm going to give it to you straight. High cholesterol comes from eating too much sugar, too many carbs. Okay, it does not come from eating eggs or red meat or butter. As a matter of fact, research shows that eating butter, red meat, now again, I'm talking grass-fed or healthy red meat, organic, things like that. Red meat, butter, eggs, like our grandparents and great-grandparents did, you're going to have lower, healthier cholesterol levels. It's when you eat too many carbs, too much sugar, that's what drives high cholesterol. Now again, you want to have good levels of cholesterol because too low cholesterol can be bad too. It actually has protections for the brain, so on and so forth. Number 2 is going to be if you have high fasting blood sugar or high A1C levels. Okay. The reason you have that is because you continually eat carbs and sugar on an empty stomach. Okay. I'm not saying you can ever have those things because there's a place for those things, but you always want to have protein first. So for instance, if you get up in the morning on an empty stomach and you have toast, okay, that's going to spike your blood sugar right up. If you have eggs and toast afterwards, you're not going to get that blood sugar spike. Again, this is research proven. It's also seen if you've ever heard of a continuous glucose monitor. People that wear these will tell you if they have some pretzels or some chips on an empty stomach, spike. Whereas if you have, let's say you have a dinner with chicken and broccoli and maybe a couple potatoes with that, then afterwards you have ice cream, you're not going to have a spike. It's having simple carbs or sugar on an empty stomach that's going to cause that to spike. You continue to do that, your A1C level continues to go up again. So you want to have protein before you have carbs or sugar. And number 3, if you have high inflammatory markers, meaning your CRP, your homocysteine, even something called PLA2. The reality is most of your doctors aren't even checking these things, but these are inflammatory markers that you can check in your blood work that gives you an overall idea of how much inflammation is in your body. The more inflammation you have in your body, the worse off you are. Again, it's going to cause oxidation of the cholesterol in your arteries, so it's going to cause plaque in your arteries. It's going to cause joint pain. The last thing you want is high inflammation levels. So again, if you have high homocysteine, PLA2, CRP, you want to do this following thing here. You need to look up all the different vegetable oils that you consume. Again, examples of this are going to be things like peanut oil, soy oil, canola, corn, safflower, sunflower, all these different oils that are in all packaged foods like chips and pretzels and all that, those different things. A lot of people will actually cook in these oils, which is the last thing you want to do. All right, they're highly, highly inflammatory. The oils that you want to use are going to be coconut oil. You want to use olive oil, but not cook it too high. Avocado oil can be good, and butter, natural grass-fed butter. That's what you want to consume. You don't want all these other vegetable oils. That's been a lie told to us for years. And you'll see by cutting out vegetable oils, your joints will hurt less, your blood work will improve, even your cardiac blood work, like your cholesterol, triglycerides, all that will improve, and you're going to feel way better overall. Okay? Those 3 tips, you're going to have massively better blood work.